Hello and welcome to the Rural Communities Opioid Response Program East Tennessee Consortium, trauma-informed care training designed to help address the opioid crisis in rural East Tennessee. My name is Brian Wimbigler, a community pharmacist and assistant professor for the UT College of Pharmacy. I'll be your host as we move throughout this training. This presentation was supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services as part of awards totaling $1.75 million with 0% funded with non-governmental sources. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by, HRSA, HHS, or the U.S. government. I have no conflicts of interest to declare for this training brought to you by Nurturing Options for Women or NOW that aims to prevent neonatal abstinence syndrome in rural East Tennessee by improving the quantity and quality of the provider workforce across prevention, treatment, and recovery. The Hill and Servolution Health Services of Claiborne County and Schools Together Allowing No Drugs or STAND of Scott County are partnering in these efforts. Initiatives include, first, enhancing quality of the provider workforce through professional training, such as the module I'm presenting here now, incorporating family planning into healthcare visits, and finally, expanding behavioral health workforce and youth health promotion services. This training covers several topics. We will define trauma, secondary trauma, and discover skills needed to help those who have experienced trauma heal. We'll look at toxic stress and adverse childhood experiences, or ACEs, and discuss how those experiences impact the brain, child development, and lifelong functioning and health outcomes. We'll look at how trauma can affect particular groups disproportionately, specifically women. You'll learn ways to prevent and address re-traumatizing patients or clients, and how to apply practical strategies for trauma-informed knowledge and care. Last but certainly not least, we will review the importance of self-care and making sure that we take care of ourselves so that we can better take care of our patients. It is important to both realize and recognize that the patients or clients we work with may have suffered from past trauma. In order to address current issues impacting their health, we need to understand the impact of the trauma and the role it had or is currently having on their current situation. We need to be compassionate and show empathy, but we must first understand trauma, learn to recognize it, and then share this understanding. In the picture below, you can see examples of adverse childhood experiences, or ACEs, above the surface in the tree branches, many of which are the result of, or at least rooted in, the social and environmental factors that many of our clients have no ability to change. The word trauma can be used to describe both an event that is traumatic and the after effects of experiencing a traumatic event. Physical damage to the body caused by violence or an accident is often easy to see, and the healing process can be monitored, but the emotional, mental, and spiritual wounds or shock resulting from that physical injury is much harder to quantify and can have long-lasting effects. Trauma comes in a variety of forms and typically falls into one of three categories: acute, chronic, and complex. The order of these listed on the slide is intentional and correlates with the magnitude of the relative trauma and the likelihood of a complete mental recovery. Acute is just that, a single one-time event, usually physical in nature. Chronic can be a single recurring trauma or the cumulative effect of several related or unrelated events. When you look at acute trauma, that can be as simple as an automobile accident or a natural disaster such as a flood or hurricane. Looking at chronic trauma, that could be the car accident, then the endured medical trauma related to the recovery of the accident. But it's the cumulative effect of several traumatic events. Complex is a tough one and often starts at a young age. impacting brain development, affecting the ability to form interpersonal bonds, which are the main source of safety and stability. This could be something like ongoing abuse by a parent or simply profound neglect. Complex trauma involves relational trauma or trauma resulting from abuse and neglect from a parent or close caregiver. When basic needs are not met or trusting relationships are unhealthy or broken, an example being sexual abuse, the child's brain changes. These changes in the brain, including a reduced frontal cortex size, which controls memory, are a natural response to help block out, deal, and numb the emotional and physiological response to that trauma. This also impairs the brain's ability to manage and regulate emotions, causing children to constantly feel fearful and unsafe. This contributes to relationship and behavioral issues later in life and makes it harder to treat those current emotional and unstable feelings that they might be having currently. Other types of trauma include race-based, historical, and cultural trauma. Trauma based on race can be the cumulative negative impact of racism on the lives of people of color. Experiences rooted in racism create persistent distress that can not only overwhelm a person's, but an entire community's ability to cope. Historical and cultural traumas affect generations and groups with shared identity. Slavery, displacement, disease, and historical disparities and stereotypes are all examples of historical and cultural trauma. Toxic stress is the chronic activation of the fight or flight part of the brain. This can be positive when faced with a danger by briefly increasing the heart rate and elevating stress hormones in preparations for fighting or running away. It can also be tolerable when buffered by supportive relationships and outside support. Think about work pressures or dealing with a difficult health diagnosis, and the support that comes from coworkers and close family and friends. Stress becomes toxic when persistent in the absence of protective relationships. Examples include physical or emotional abuse, chronic neglect, caregiver substance abuse or mental illness, exposure to violence, and the accumulated burdens of family economic hardships. This prolonged stress changes brain development and is directly linked to cognitive impairment and other negative health outcomes. For children, adequate adult support that can help relieve prolonged activation of the stress response could come from trusted teachers or counselors at school who are aware of toxic stressors the child experiences in their home environment. Attachments to adults who can provide a safe environment and time away from stressors reduce the effects that toxic stress has on their developing brains. Research has consistently found that children with significant and ongoing trauma responses are often diagnosed with mental health disorders. Some of those include reactive attachment disorder, attention deficit hyperactivity disorder or ADHD, oppositional defiant disorder or ODD, bipolar disorder, and conduct disorders. Increased awareness of the impact that trauma has expanded our understanding of mental health diagnosis and how to better treat children and other people suffering from them. Trauma-related stress disorder, TRSD, such as adjustment disorder, and PTSD, or post-traumatic stress disorder, are now more widely understood and used to describe symptoms specifically. The Adverse Childhood Experiences, or ACEs study, was groundbreaking research that linked childhood experiences to health and social outcomes later on in life. The three types of ACEs include abuse, that can be physical, emotional, and sexual, neglect, which can either be physical and or emotional, and household dysfunction, which includes mental illness, incarceration, spousal abuse, substance abuse, and divorce. ACEs in early adversity has lasting impacts. Those experiencing abuse, neglect, and or household dysfunction are more likely to experience physical injury, some of which is tied to risky behaviors, women are particularly vulnerable, and mental health outcomes including unintended pregnancy, pregnancy complications, and fetal death are much higher among women. Infectious disease rates, mental health issues, and chronic diseases are also more prevalent among those suffering from ACEs. Negative outcomes and associations increase as the number of ACEs increases, while positive outcomes and opportunities for education, career advancement, and increased income all decrease. You can see here the mechanism by which ACEs negatively influence health outcomes. Starting at the bottom, you see factors that are well outside of a child's control. This includes generational and historical trauma. Then comes social determinants of health. These are the conditions and the environments where people are born, live, learn, work, play, worship, and grow older. This is all followed by the ACEs themselves. This all drives disrupted neurodevelopment, which leads to social, emotional, and cognitive impairment. People then turn to risky behaviors and misuse drugs and alcohol to escape the constant feelings of fear and distrust, which puts them on the path to disease, disability, and compounding social and emotional distress, leading ultimately to the tip of that pyramid, which includes premature death. Take the current opioid epidemic, record overdose deaths, and increasing numbers of infants born with neonatal abstinence syndrome. These are babies who are born dependent on substances used by their mothers, as examples of health issues that contribute to early death. Adverse childhood experiences are more common than one might think. Almost 2/3 of the tens of thousands of study participants included in the ACEs study reported at least one adverse childhood experience in their lifetime, and more than 1 in 5 reported 3 or more ACEs. And remember, those negative outcomes increase as the number of ACEs increase. 64% of participants reported experiencing at least one ACE. So in your practice settings and when you're working with patients and clients, it's most often safer to assume that who you're working with has experienced at least one ACE, because greater than half of the study population reported at least having one adverse childhood experience. The more ACEs someone experiences, the more likely they are to engage in behaviors known to and directly linked to poor health outcomes, like smoking, alcohol misuse, illicit drug use, early sexual activity, and sex with multiple partners. They are also at higher risk of developing chronic disease and related medical problems, alcoholism, depression, heart, liver, and lung disease, and sexually transmitted infections. Adverse childhood experiences are associated with poor health outcomes, but exposure to ACEs alone does not predict or predetermine that someone will have poor outcomes. Recovery from and avoidance of future trauma can be assisted by positive, trusting relationships, a healthy lifestyle void of risky behaviors, strong community and societal reports, and also genetics. So simply by experiencing ACEs does not predispose someone to negative health outcomes and struggles later on in life. Being trauma-informed includes an understanding of and appropriate responsiveness to the impact trauma can have on someone. Providing a safe treatment environment that does not judge, stigmatize, or otherwise re-traumatize a person, emphasizing physical, psychological, and emotional safety is paramount. This creates a safe and open opportunity for those who may have suffered from and survived trauma to rebuild a sense of control, trust, and empowerment. And this quote is really powerful. It's likely that everyone has experienced an event that could be considered traumatic. Many factors influence how a child or an adult will make sense and cope with traumatic events. Not everyone who experiences a traumatic event shows trauma symptoms or identifies with being traumatized. A program, organization, or system that is trauma-informed realizes the widespread impact of trauma and understands potential paths for recovery, or at a bare minimum, has a readily available referral network when needed. They also recognize the signs and symptoms of trauma in clients, families, themselves, and also their staff. They respond by fully integrating knowledge about trauma into policies, procedures, and practices, and seeks to actively resist re-traumatization. Trauma-informed care or services are characterized by an understanding that the problematic behaviors may need to be treated as a result of the ACEs or other traumatic experiences someone has had, as opposed to addressing them simply as willful or punishable actions. Being trauma-informed means working to eliminate or at least reduce the impact of discrimination, devaluation, and stigmatization by the public, systemic issues with access to care and resources, for example, women in rural health areas lacking access to OB services, contraception, and substance use disorder treatment. All of this while building trust and empowering positive change in their patients to lessen the internalization of negative stereotypes and devalued self-worth they may be feeling. Reducing disparities in trauma services include overcoming unconscious bias and stigma, reducing those barriers to care, and educating the public as a means to increase understanding, reduce social stigma, and strengthen societal and familial relationships, all while encouraging positive ethnic and cultural identity. To be trauma-informed, you need to know that trauma may exist, and one of the most straightforward, consistent, and reliable ways to do this is to simply screen for trauma. The links below provide a variety of screening tests for both children and adults. There's a whole bunch of ways to do this, but one of the easiest ways to implement is just to use a universal screening included with the new patient or intake paperwork. Using this method can help make people more comfortable opening up, and they feel like they aren't being singled out. An ACEs screening on an adult needs only to be performed once, since adverse childhood experiences have already happened, and ACEs screening scores don't change or change very little. If the results are positive, you need to have a plan to address the trauma, or at a bare minimum, be able to provide a referral and a warm handoff to another provider. This is just a snapshot of what being trauma-informed looks like in practice. Most certificate courses are comprised of 15 or more hours. There are also free resources beyond this presentation to prepare you to be trauma-informed. A link to several options for additional training is below at the bottom. I encourage you guys to take a look at that and get more training so that you're better prepared to treat your patients that may have suffered from trauma. Re-traumatization can occur when probing questions about specific experience are asked and should be avoided if possible. Just simply accept their screening history. Based on that history and their ACEs score, you may need to address trauma or tailor treatment to account for the type of trauma that they experienced. If specific information is needed to guide therapy or treatment, you may need to qualify why you're asking sensitive questions. For example, I need to ask you about your sexual history so I know what tests you may need. When it comes to sensitive and private parts of the body, let the person's body language and contextual cues guide you. If they appear nervous, try to help them feel more comfortable by allowing a trusted friend or family member into the room. When confronted with resistance, respond with compassion, work with them, and use motivational interviewing skills to create a discrepancy to motivate change rather than forcing them or becoming visibly annoyed. One of your goals as a trauma-informed provider should be to empower the patient or client to be an active participant in decision-making and action-taking that affects their lives. Look for and highlight the positives in their lives and seek to include their advocates in the big and small decisions. To successfully empower a person, you must see them, you must hear them, and you have to be engaged with them so they know you value them and understand and accept their past trauma. Don't forget to put on your trauma-informed lenses to help you see and uncover underlying trauma that may be the root cause of, or at a very minimum, a contributing factor in the behaviors you are trying to change. Allow your trauma-informed lens to help you understand and empathize with how the patient is feeling and also how that makes you feel. Be mindful not to allow your physical or emotional responses to their trauma make that person feel uncomfortable. Change the topic or simply take a break from the conversation if needed. Please do not overlook basic physical needs and get case management involved if food, housing, work, or other dire social factors exist. If a person's basic needs are not met, enacting positive change is extremely difficult. Once basic needs are being met and they feel safe in their current situation, then you can effectively begin working to enact positive behavior changes that lead to improved health outcomes and decouple the person from the negative health associations linked to their ACEs. Look and listen for any indications in your conversations that may make them feel unsafe or re-traumatized. Have a plan to address emotions and triggers that are unavoidable. Examples include court mandates, scheduled drug tests, and emotional stressors that you have previously elicited from the patient or client. Do your best to understand your patient's trauma reminders or triggers. They can include simply the time of day, anniversaries, seasons, activities, places, people, things, sounds, sights, smells, or other stimuli. Use words to help separate the trigger from the person and help separate their past ACEs from where they are now. Avoid words and actions that may cause feelings of shame, and try not to re-traumatize the patient or apply any undue or unnecessary stigma to what they've expressed or shared with you and how it relates to their adverse childhood experiences. Seek support from your circle of care or a counselor, and always be ready and willing to refer the patient for more advanced care, and also be willing to have those relationships set up ahead of time to provide that warm handoff. Remember, if basic human needs are not being met, then enacting positive change is extremely difficult. Do what is in your power to make sure basic needs are met, or at a minimum, acknowledge and validate disparities when they exist. Be responsive to individual needs such as culture, race, ethnicity, reading level, sexual orientation, and ability, both physical and mental ability. Know that your own life experiences and perspective affect how you both view and respond to others. Do your best to apply the individual's perspective to your understanding to better understand and empathize with them. Proactively seek ways to enhance connections to their background, their communities, and the support systems available to them. Simply take a drive through their community to better understand what a day in their lives looks like. Always be supportive, accepting, and be an advocate for your patients and clients. Focus on every positive and victory, no matter how big or small. Use language that highlights their worth as a person and separates them from behaviors linked to their specific traumas. As appropriate, include others involved in the person's care and make sure those providers are knowledgeable and can provide trauma-informed care. Reimbursement for providing trauma-informed care is lacking, and in some cases, reimbursement for same-day and two-generation services are prohibited. Most primary care visits are limited to 10 to 15 minutes, making doing a screening, discussing the results of that screening, providing follow-up care, and possibly referrals nearly impossible in that time frame. The separation between physical and behavioral health service systems creates additional barriers and makes it vital to have those relationships predetermined, set up, and have the ability to provide warm handoffs so your patients and clients don't feel alone. Accountable care organizations and patient-centered medical homes provide coordinated care and increase the opportunity for successful trauma-informed treatment, and this might be a good place for patients who have exceptionally high ACEs scores. Don't forget to protect yourself. When working with people who suffer from trauma, it's not a matter of if you will experience secondary traumatic stress, it's a matter of when and how you deal with that. Secondary traumatic stress, also known as vicarious trauma or compassion fatigue, refers to the experience of people who are exposed to others' traumatic stories. As a result of this exposure, people can develop their own traumatic symptoms and reactions. Burnout is a term often used to describe the experience of being overwhelmed by secondary traumatic stress and compassion fatigue. So just like in an airplane, put your own oxygen mask on first so that you can help those around you. To better protect yourself, you need to be aware of some signs of secondary traumatic stress. This can be as simple as just you're more irritable. You may express apathy or a lack of empathy, not only at work, but in your personal relationships. A general loss of motivation and fatigue. You may experience unhealthy weight changes. You might have difficulty thinking clearly or quickly when you otherwise don't have that issue. And at the extreme end, you may experience suicidal ideation and thoughts of death. So these are not benign symptoms, so you have to be cognizant and you have to be able to protect yourself so that you can better take care of the patients and clients that you serve. Self-care is an important aspect of all areas of life, not just in the clinical or treatment environment. So, ways to take care of yourself. Exercise and stretch as often as you can, even if it's not that much. Find ways to decompress and play. It's just as important for adults as it is for kids. Seek out those sources of enjoyment and inspiration that recharge and motivate you. Stay engaged with your support systems, and if you need counseling yourself, seek that out. Make and keep appropriate boundaries, specifically in the patient-provider relationship. Practice mindfulness. For example, conscious breathing or meditation. Research has shown that regular practice can improve brain function and help with stress. Prioritize work and life balance. Advocate for it for yourself and for those you serve. Observe and learn how supporting others in trauma is affecting you emotionally, behaviorally, and physically. Work to better understand your background and how it impacts your well-being and coping. Learn your own triggers and warning signs. And when you need it, ask for help. You can't pour from an empty cup, so always take care of yourself first. You gotta nourish to flourish. Practice good self-care so that you can better provide care for others. Thank you for taking the time to complete this training and for your interest in this topic. Should you have any questions, the easiest way to contact me is through my email address, and it's bwinbigl@uthsc.edu. Thank you again for your participation.